Hello, and thank you for joining us for part 4 of this 5-part series. I'm Paul Karpecki. I practice at the Cincinnati Eye Institute in cornea services and ocular surface disease research. And in this module, we're going to cover the importance of billing and coding, follow-up exams, as well as the entire economics around dry eye management and punctal occlusion.
I'm Doug Devries. I practice at Eye Care Associates in Nevada. It's a statewide co-management center. In discussing the billing and coding aspect, certainly is the important part of a comprehensive chronic dry eye practice and really building a subspecialty. If you're going to see those patients, reappoint those patients, you have to know how to properly bill that patient, how to properly code that patient. In a discussion plan with a patient, whenever you're seeing that patient and reappointing, anything that you've talked about further treatment, it's helpful to document that, particularly when it comes to the next step of putting in punctal plugs or punctal occlusion. At that particular time, any literature that the patient has received, a brochure or a video that they may have seen, if that's documented in the medical record, it's a stepwise progression from the standpoint should an insurance company take a look at your chart notes. As you go through that, the initial education with the patient and you start them on, if they're a patient that you're going to be starting on an anti-inflammatory such as a corticosteroid and the topical cyclosporin, you'll want to note about lowering that inflammatory level and then coming back in 4 to 6 or 8 weeks with punctal occlusion. And at that particular point, I always hand a patient a brochure on the Odyssey Parasol. It gives them an opportunity to investigate it on the web, to really find out. I find that nearly 50% of my patients, when they come back for their follow-up visit, will make a comment to the front desk, "I'm here for my plugs." Now, they don't fully understand it, but we've actually gone through that education process. It's been documented, so when that patient checks in, they're really ready at that particular point to hear about the next level of therapy that we're going to use with them to try and increase that quantity after we've improved that quality of tears. Another important aspect of when you put the plug in and you document it, it really needs to be documented in the chart as a procedure, and so very handy have a peel and stick up note that can just be taken right off. I put it on the inside of the folder, also put it on the bottom of the exam, and then you simply make a notation, 1 drop of tetracaine or whatever anesthetic you use, patient tolerated, procedure well. So you have some type of a documentation following that the insertion of the punctal plug.
I agree with a couple of things that are very important. One is setting the proper expectations and documentation. I think it plays 2 roles. Number one, these are chronic conditions. Patients who have dry eye will have dry eye for most of their life. It usually continues. There are a few that we are able to cure, but it's a very small percentage. So it's really managing the disease. And I think they need to understand that expectation. I think the other factor is their follow-up. I tell them I'm going to see them back in a month and at 3 months. So they actually have 2 exams already scheduled, and it's just part of the process. We want to see, if they're on anti-inflammatory, what impact it's had. We're looking to when we're going to occlude, what level the disease is managed, whether it's at 1 month or whether it's at 3 months. But that's my typical follow-up, and I think setting those expectations works very well for the patient knowing when they're going to return, how we're going to manage it, when we're going to consider punctal occlusion, so they can anticipate that from the earlier steps. I also agree that on the documentation is very important in regards to the setup of the procedure, in terms of the education of the patient, as well as documentation. Certainly having those sticky things you can just put right in the chart are valuable. If the plug should extrude or the patient happens to take it out somehow with their nail by accident, it's nice to know what was inserted. Even though 95% of all the plugs necessary are 2 sizes with the Parasol, it's good to know which of those was inserted the first time so we could look at other options or even replacing it in certain circumstances. So I think that those play a significant role. I also agree with the staff component, which you mentioned. I believe that's important too in terms of how they conduct it, saving you time, informed consent, the expectations, the patient education, so then you can come in, do the procedure, educate the patient on that, and then allow them to go from that point.
Odyssey has done a wonderful job with their website in going through comprehensive billing and coding. It's an important aspect. And the nice part about this, it just doesn't refer to punctal occlusion. It refers to really all aspects of chronic dry eye treatment. Because when you set that expectation for that patient, they understand the chronic nature, they're going to have to be seen on repeated visits. It's back to the concept of there are multiple etiologies underlining, and therefore there's multiple treatments that are going to be necessary, and that also includes multiple visits. That's the only way that you can assess and modify that treatment is to see that patient back. Now, most of those visits are going to fit under an evaluation and management code, the 99-212, 213, or 214. Now, of course, the level of that code is going to depend on what you have documented in terms of history, in terms of exam, and in terms of medical decision making. But I find most of the follow-up visits will tend to fit in either the 212 or 99-212 or 99-213 area. Now, when you're seeing that patient and you're providing that service with that evaluation management code and you're using your code for punctal occlusion, you have to make sure that you also include the modifier 51, that you're doing multiple procedures on the same day. If you're putting one in the right eye and one in the left, the lower right and the lower left, it also has to be utilize the E codes, which will tell us on whether it's the left upper or the left lower or the right upper or the right lower. Those codes have to be used in conjunction. Again, all of those examples are available on the Odyssey website. Important to keep in mind that there is a 10-day global period with punctal occlusion. So if you see a patient back within that first 10 days, that's part of the global fee. If you happen to see that patient past that point, and usually the plug follow-up visit will be a good month or 2 months down the road, that again is a billable visit under an E&M code. And those billing guidelines, again, have been outlined very nicely on the Odyssey website.
You know, that's very similar to how I manage these patients in terms of what you described. My typical first visit is usually comprehensive. We have to check the retina for diabetes and other conditions that can contribute to dry eye. So if it's a new patient, it tends to be a 92004 many of the times, or if it's established 92014, if I meet all the criteria, which I usually will. The second aspect is that the 1 month visit typically for me is a 99213. Again, if it meets all of the criteria. And then at the if I do punctal occlusion often at 3 months, tends to be a common time for me to do that. Sometimes I'll do it sooner if we can manage the lid disease sooner, but typically about the 3rd month. And then I'll use exactly the coding you have, typically E2, E4, because I tend to do the lower lids. And then I will see the patient, reschedule them outside of 10 days. Now, if they come in that 10-day global period, as you mentioned, Doug, that's probably because something wasn't working, or one fell out, or they weren't sure. So that's in the global period. There's no extra billing that's related to that procedure. When they come back beyond that 10-day time to follow up on their results to see how they're doing, if there's any sort of treatment changes or discussion related to it that's significant, it may well be a 99213. If it's a very quick visit, the patient is really doing well. All of these options have treated them nicely. It can often be a 99212. So that's a good regimen of where they're at. The real value to the doctor is also economically, and I know we don't work in this field for that reason, but you know, we've analyzed in our clinic some of what we were able to generate per patient, whether it was glaucoma, whether it was cataract surgery, or it was dry eye. I think you'll find this very fascinating, that we actually have a greater revenue per year on our patients with dry eye than our reimbursement for cataract surgery. And that sounds amazing, but it's actually very comparable. Glaucoma is a little bit higher. And this is not any extra testing. This is just good, sound management that meets the criteria. As I said, we're doing this to manage the patient. That's the most important thing that we're doing. But I know to doctors that if they're going to take this medical model in the area of dry eye, that becomes very important. Certainly if they did bulk punctal occlusion, you can actually get the bulk parasol plugs, where instead of just getting them on the individual inserters, depending on your preference, which would actually be even more economically viable. So those options exist out there, and I think it's also quite important to continuing practice. As I said, the greatest satisfaction is certainly not that. The greatest satisfaction is the impact on our patients' lives, as we described earlier. It's the impact on the ocular surface. It's them being able to go back and function like they hadn't before and enjoy life because the ocular surface and dryness is finally alleviated, and that is why we do it. But without a doubt, doctors want to know the billing, they want to know the coding, they want to know how it applies. So I believe Doug, you did a good job in terms of outlining this, including modifiers, follow-ups, the coding and billing for each exam, and hopefully this gave you some pearls. Thank you for joining us for this fourth module, and we look forward to seeing you on the fifth and final.